Okay, good morning. Thank you guys for showing up on this very lovely Tuesday. And just love to see everybody smiling, and the sun is making me very happy today. So I hope everybody is that transference. I see Emily nodding her head too. Yes. So I'm going to hand this over to Megan so we can go over the agenda and be back with you guys shortly.
Good morning, everyone. We will just do a couple quick items. Oops. I've got too many things going on at once. Hang on one second. Okay, sorry about that. I had a brief technical difficulty. We'll be together for just a few minutes, and then we'll spend most of our time this morning in our work groups. So I'm gonna hand it back to Melissa in just a minute for a few childcare licensing updates, and then we'll do our usual bright spots and innovations if anybody has anything they want to share. Then we're going to talk a little bit about the process for actually putting recommendations forth and the timeline for that. And then we'll hand you over to our groups. And after that, we will not return to the main group today. So if anybody feels like they get through and has a little bit of extra time, feel free to head on to the rest of your day. Otherwise, we will just compile everything in notes and get that back out to you. So Melissa.
Megan, correct me if I'm wrong, but next month's meeting is in the evening, right?
That is correct, yes.
Okay, I did want to share that with everybody and call that to your attention, as that will look different on your calendar request. So just make sure you plan accordingly. But next month will be our evening session to allow for more providers to be on screen with us. I wanted to take a few minutes to share some KDHE updates and what we've been doing in the background through some of our work through the CCSIT team and recommendations. A policy exception we just added on our website. We have a lot of what we call blanket policy exceptions. This is an opportunity for the program to quickly pivot and provide an exception when we note possibly any type of barrier that would impact multiple facilities within one program type. And through the CCSIT process, we looked at staff qualifications, streamlined, and some of our actual policy exceptions geared towards program directors and staff have bubbled up through the CCSIT team. So I always appreciate that. One recent policy exception that we just did implement was for program directors who oversee facilities of 100 plus capacity. This needed to be addressed. Education had already been achieved through our previous subsection within our regulation, and we really felt like we were being a hindrance to program directors moving through those type of facilities with that capacity level. We still do require the work experience, but we already do acknowledge that the program director has met their education requirements. So that is a new policy exception. And what was really exciting about that is we have a team at KDHE who reviews all of our program director applications, and she was able to quickly move a lot of people into the system and not be a barrier to facilities who know we have a very transient workforce right now in our center facilities. And so this was a way to really make sure that we were meeting the needs of program directors. KDHE also has partnered with the Department of Defense to provide another type of blanket policy exception. Currently, KDHE does not regulate any facilities that are on bases such as the Air Force Base at McConnell. Wanted to say McDonald, that was very inappropriate, so McConnell. And what we have done is looked at help them redefine their geographic location, meaning Space is at a premium, not just within our communities, but also within base locations. So housing is also being moved outside of their normal traditional, where we would not have any authority to regulate. But it does not mean that that is still not their property. They've just redefined what is a federal property within our policy exception. So in short, in summary, if a federal provider, a military provider had housing off base, they still fall under that umbrella as long as they are just serving military families and children. So we would not regulate that. And we wrote in some really good faith partnership. So our surveyors would be aware of those different entities. Also wanted to give a shout out to the preschool development grant and our media campaign because they have been able to provide us some funding. I know we talk a lot about the media campaign, but now we actually have some funding behind it. So you will be seeing that into an airwave soon to come to you. Megan and I will be meeting with communications at KDHE and OSB, otherwise known as Orange Sparkle Ball, to actually do some media buys. We really want to be very conscientious about where we are targeting, because I know everybody can acknowledge that we have a childcare crisis across the state, but we really want to make sure we're getting our most bang for our buck. So we will keep communities involved and enlightened of where we look at what makes the most sense for those media buys. And we will also have the provider toolkit to complement all of the media outlets that we will be targeting. And I'm also really excited to share a new innovation that KDHE has been working on. This is going to be brand new across the state. And it's really an opportunity for childcare licensing to redefine our work based on needs that we recognize within communities. And this might feel like a rural initiative, but it is really a statewide initiative. Several years ago, I was personally approached by a provider in Ashland, Kansas, who shared a story. She was a group daycare home who wanted to move into a commercial setting, but they didn't have the infrastructure and the staffing to support a full-blown center. And she sent me a proposal looking at a small center pilot for a capacity of 13 to 23. And it impacted me, and I never let it go. I always kept revisiting it and kept looking at it. And finally, under the guidance of our leadership at KDHE, we put together a small center pilot to really look at that particular capacity. I like to call it a group daycare home on steroids, but under the umbrella and the health and safety guidelines of a center. And I really wanted to share this topic with you guys today because we do have many group daycare homes currently in a commercial setting that may want to look at this project. And we have small centers who may want to repurpose their use of space. We are really limiting it to a capacity of 13 to 23. And what I'm most excited about is when we get ready to push this out the door and really start engaging communities and facilities. This is an opportunity to really look at redefining what new regulations in Kansas and really looking at the possibility of a new category of care. We've been challenged at looking at small centers, and we looked at Colorado and other states that actually have a small category of care, but it was really looking at apples to oranges and not defining it based on Kansas need. So what I'm really proud of the work that we put together looking at this project is that we threw all of that out the door and really put a Kansas touch to this, looking at our current regulation. Again, more information will be forthcoming, but I just really wanted to share this morning because the work that you guys do within the CCSIT team is very meaningful to our agency and our program. We just don't shelve ideas and put them away. And the provider in Ashland, Kansas is a perfect example of us continuing to be challenged in a very thoughtful manner and actually putting our thoughts to paper and making it happen. So, when you get into your work groups this morning and you start putting down ideas, really continue to challenge the system in a thoughtful manner, because we do continue to look at those, and we will, may not happen this year, but those are thoughtful practices that we will put in place. So I really wanted to share that with you, and really, again, excited. And hopefully during our next meeting, I'll have more information to share with you regarding the small center pilots.
Thank you for those updates, Melissa. Are there any comments or questions?
Okay, Megan, you can probably just move on to our next agenda item.
Sounds good. Okay, so we have started taking a little time each month to celebrate. We know there are always a lot of things happening in the early childhood system. And so this is the time, if there's a bright spot that you want to share in your work or in your community, or we just heard Melissa talk about some innovative ideas and solutions being looked at for childcare. So if there's something that you want to share with us, please put it in the chat or come off mute, and we'll take a few minutes to listen to those.
All right, Megan, I know you all are doing great work. So I'm the teacher in me later is going to pull people aside and say, you need to share more. But thank you for all that you do. And I think we did have one question, Megan, that just got dropped in the chat from Natalie, asking if anybody's the governor's task force was just announced, and asked if anybody on this call is on it.
This is Jennifer. I am on it and looking forward to it.
Thank you, Jennifer. Won't be an easy task. Okay. Probably move on.
Okay, so we're going to go into our work groups in just a minute. As you know, we've been working on recommendations, and for those of you who have been with the CCSIT for a little bit, this will feel like a familiar process, but it's been a few months. So the goal is for the groups to complete the recommendations using a template that all of your facilitators will use during today's meeting, if possible. We know some groups are, I think most groups are in a pretty good position, but certainly we want to take enough time to make sure that groups feel good about it. So once we get through the drafts today, everything will be included in meeting notes for all members to review. We know several people were not able to make it today, so we want to make sure that there's plenty of time between meetings for people to take a look at the language, make sure they have time for questions and any comments that they have, which we'll talk about at our March meeting, which is Melissa mentioned is an evening meeting. So hopefully we'll be able to have strong attendance during that. If you have any questions or comments in between meetings, of course, send them. You can follow up to Julia when she sends the notes, and our team can make sure to get answers back to you. We'd like to kind of make this as smooth a process as possible. So if you have questions, please don't feel like you have to hold them until the March meeting. But certainly we want to make sure that the group feels comfortable enough to move the recommendations forward. So again, the goal is to try to get through draft recommendations. They don't have to be 100% perfect today. But if after today groups need more time, we will reassess that timeline. We want to make sure that you feel good about what you're putting forth. So we will just kind of see how things go today, but we've got a little bit more than an hour for the groups to work at this point. And again, we will not be coming back to the groups, so to the main group. And then just as a reminder, next month is an evening meeting. It's the same date as this month. And then we'll have morning meetings on April 18th and May 16th. So with that, Julia, if you can send us on our way, that would be great. Thank you all so much.
All right, here you go.